And all of us have read the book from Simon Sinek, Why. So I just wanted to understand what does Jijivisha do and how were you inspired to start it? You have a journey, as we discussed in your introduction. You started as a doctor. You did your MHA. Then you have worked here in India, and then you're working in UK. So what was the inspiration behind it? What was the reason, and what was the introspection you did to actually start this initiative?
It's so funny. I was just, I mean, I came late last night, and then I met my hosts and my best friends. So DJ was telling, we were talking about trying to look at something pivotal, talking to younger people. So I was talking about the concept of purpose. So my daughter's named Naya. It's basically an African name meaning purpose. And then we were talking about Simon Sinek, and he was talking about, have you read this book? I was like, yeah, you told me this like in November. You brought up Simon Sinek again. So I think for me, getting into public health has been a memorable experience because I mean I've had uh, my purpose kind of defined very early in life. The second year of college, I was basically already ready to get into this. So for me, it's always been a driving factor. I'm not a workaholic, but it's just passion about what I want to do. I think I've been in UK working for a while now in the care sector, and I've also worked in the healthcare sector in India. So, and all throughout my life, when I've been introspecting, a couple of years ago, I basically know that my common thread throughout my career has been you know healthcare workers. I mean, right from working with my first
Wonderful.
opportunity in the Himalayan foothills, with traditional birth attendants, to working with vector control workers in Goa, to healthcare workers and nurses in tuberculosis control in Mumbai, to then working with care professionals in London. So the idea of Jijivisha and the idea of focus of looking at care in India basically emerged through policy research in 2019. So I mean, I really wanted to do my PhD because I had tried to do my PhD when I was in TIS in earlier, but before I went to UK, it was not possible. Work-life balance and work and study balance was not really effective. So I had to kind of leave it. But then I said I'll look at a PhD here, and I was looking at care in India. So I started looking at policy analysis, and then realized that there is such a huge gap in implementation of basic things. Leave aside policy. So I then said I wanted to understand a little more how could I explore things further. So that's when it emerged in terms of this idea fueled up. I had a chat with one of my best friends, Subhash, who's my batchmate, roommate, and colleague at TIS. And he said, why don't we go and implement a pilot in Kerala? And then COVID happened. It's like, that same month I was supposed to come to India to actually start working on that particular idea. COVID happened. Unfortunately, it never saw the light of day. But then this was shared, and I think it just came to me. I was in there in thoughts, but it came to me last year, early June, July, thinking that, fine, Dyson, it's high time you start looking at this because, you shared it off for a long time. I think it's the prime time to kind of enter the area. So I decided I will start looking at what has to be done. And then um, I had already built up some of the concepts. And then in somewhere in October, I was basically fiddling with the idea about what the name of the organization would be. And that's when Jijivisha came into existence. Jijivisha, simply put, is to describe somebody who live lives to the fullest. So that's the vision of the organization. Then came to it, assisting you to live life to the fullest through training, care, and support. So when we say you, it could be anybody. But I mean, our focus would be on vulnerable communities. But it could be any person who might require assistance. Like we have people who have accidents. We have people who turn into different transitions to health concerns. Like people might get cancers or debilitating diseases, or maybe somebody might have an infectious disease that requires support. So care is basically everybody's cup of tea. It's not just for a specific group of people. So that's why the word you, it's not specifically just for vulnerable populations. And we do stand for exceptional care, exceptional training and compassionate care, because that's our modality and focus. So we have four focus areas. We call them the four C's. So one is care training, one is career support and mentoring, consulting solutions, and client-centric care. So client-centric care is one of our furthest and largest goals, because at the end of the day, we're looking at, person-centric modalities for looking at care. And we will redefine care in India in a true sense based on person-centric care. So this focus, defines individuals and their families as important focuses rather than looking at organizations' convenience. Because right now, that's what I'm seeing in communities. We're not
Right.
looking at client-centric focus, but
Absolutely.
it's basically what we can provide that we're providing them. So our focus is basically on primary promoting independence, improving the quality of life and making care affordable. So that's basically one of the prime areas.
Oh, that's quite very interesting. I think that's sums up the purpose, and I think the way you mentioned the thread uh, which has taken you to this journey and looking at healthcare workers, I think that's very interesting.